Hello to our wonderful community. I'm just popping in to let you all know that my husband Dave passed away. I had forgotten to address it. I had on social media, but not on our podcast platform. Dave died on the 29th of September. He went into liver and kidney failure and he passed away peacefully. Yes, now I'm navigating life as a solo parent of four and rediscovering who I am after 24 years of marriage. So, thank you all for your support and kindness and letting me share and be vulnerable with you. Thank you.
We are your hosts, Shell and Tiana, and today we are joined by a special guest, specialist general practitioner and liposuction proceduralist, Meaghan Heckenberg. Meaghan, thank you so much for joining us today.
Thank you so much, Shell and Tiana. I'm very honoured to be on your program discussing this very important topic.
Yay! So you were at the Lipoedema Australia conference, but we did not actually get to meet. So I really appreciate you reaching out after the fact, and I'm glad we got to connect. We have so much to get through in today's discussion.
Yeah, it was great. It was my first conference, and it was really, really informative for me. And spent the whole 3 days there, met lots of people.
So we're going to get straight into it because we've got a lot to cover today. How did you come to learn of lipedema and when was that?
Yes, very interesting question because as you probably heard from all your other guests in the past, that we learn a lot of these things from our patients' experiences. It was probably around about 7 years ago, and I was doing liposuction in Sydney on a mother and daughter, and the mother was in her 60s, and she said she had saddlebags or outer thigh fat there, and she was talking to me and saying, oh, it was really painful. And I said, well, have you seen anybody about it, maybe around the hip area, orthopedic surgeon? Yes, seen that, and that nothing wrong, couldn't find anything wrong. But she said it was incredibly painful, and she said to me, if you do the liposuction, will it go away? And I went, I don't know, probably not. Anyway, it did. And then and pretty much overnight, that kind of level of pain went away for her. And I just thought it was probably just a placebo effect because, she had a better shape with the outer thighs and she was probably just happy about getting that done. But, months down the track, the pain had gone away completely for this particular patient. Yeah, and that made me look into it.
That's not normal, right? That's not normal.
No. Well, I mean, I didn't know that fat was painful. Fat was just fat, and we took it out. I took it out to change body shapes, and then realizing that her symptoms were improved dramatically. So, and
Did
then
she know she had lipedema?
No.
She didn't know either. Okay.
No. And then it made me think, with the other. Then I started to see the lipedema come more into the space, and then I realized now that woman probably had lipedema.
Yeah.
Interesting.
So where did you first hear the word lipedema?
Okay. Now, I don't know when, but I've been looking in it for many years now. Yes.
Yeah.
And it's just getting more and more traction, and particularly with programs like yours, it's fantastic. Yeah. And then having a conference, like a 3-day conference in Canberra, that's great. And I've done a lot of looking at podcasts from overseas, like in America and Germany, and listening to their talks, and they were all recorded. And it was like going to the conference, and that's where I've sort of learnt more about it.
Fascinating. Now, look, in our introduction, we mentioned you were a specialist general practitioner and lipedema proceduralist. I think it's about time that we address the elephant in the room about this, the nuances of providing lipedema, liposuction, or liposuction in general. So before we get into advice on who should enlist to assist us with our lipedema removal, let's take a moment, if you can explain to us the difference between plastic surgeons and specialist general practitioners who perform liposuction procedures. Why should we not be calling such professionals cosmetic surgeons?
Yep. I've got a fellowship in liposuction from the Australasian College of Cosmetic Surgery and Medicine. And I've been doing liposuction for 16 years. I've done over 1,600 procedures. So I've been specially trained in liposuction. And that's the only cosmetic surgical procedure that I do. And so I'm not a plastic surgeon. And I've can't even call myself a surgeon because it's now a protected title. So that's
Oh.
why we're a liposuction proceduralist. I'm also the head of training at our college in liposuction, and I've co-authored a paper, what do we call it, liposuction guidelines that our Australasian College put out in 2023 for liposuction procedures in Australia. So look, I'm very specifically trained in liposuction. And as I said, I don't do anything else. Now, when a plastic surgeon does training in the public hospital, they don't get a lot of experience in private cosmetic surgery. Plastic surgeons will learn wonderful surgical techniques, and they treat burns and tendon repairs and reconstructive surgery. When it comes to cosmetic procedures, which is not funded by Medicare, they have to learn the same way that I learned, which is like post-fellowship with mentors and going overseas or doing it in Australia and learning from your mentors about how to do these specific procedures, because they're all got their own nuances. So just because you're very good at surgery doesn't mean that you're very good at liposuction, or it doesn't mean you're very good at doing facelifts or abdominoplasties or breast augmentation. So these are specific cosmetic surgery procedures that need to be learned post-fellowship.
Yeah, that's a really good point, and something that we don't hear very often, I suppose, because there's a lot of discourse in the lipedema community, especially on the Facebook pages, about preferentially choosing a plastic surgeon for their lipedema surgery compared to a liposuction proceduralist, or what the layperson calls like a cosmetic surgeon, because we don't have that education to know what the best terminology to call people who aren't surgeons.
Yes.
I guess I'd love your advice and your thoughts on how we as a community might ensure we're choosing the best specialist for our needs, regardless of their title.
Yep. I think it's years, like knowing how many procedures that person has done, that doctor has done, is really important, and having lots of education in it, and formal education in that particular procedure. So how many years they've done, making sure they see before and after pictures. These are important. Not every patient will allow you to show before and after pictures. So you've got to be, it's only those select few that will allow their photographs being shown on social media or internet, or even being shown to other patients. You have to get permission from them to show their before and afters to another patient. Yeah. But yeah, just,
Awesome.
I
That's
think,
some good
just
tips.
experience. Just not, I think just experience is really important. And that's why I've chosen just to do liposuction, because it's a very, I know it looks easy, like just doing
Just
this.
look easy.
Physically demanding.
Yeah, I feel like it's a massive workout.
It is, yeah. And look, I have to choose my patients carefully too, because I can't see those patients that need skin excision as well as their fat removal. I've got a very specific group of lipedema patients that I can see. It's really like stage 1 or 2. And not having excessive skin, and having having the secondary obesity. The BMI less than 35 is important. And also we do a waist to height ratio, and this is also in the German guidelines for liposuction in Germany, and that was
they
also
spoke about what at the conference, which is very interesting, changing to the waist to height ratio, which I
yes,
think is fascinating and a really good way
it's
forward
really
instead of
really
the waist to hip ratio.
Yeah.
Yep. It's really, really good, because the BMI, it's not, it's the only tool that we've got with obesity, but it's not really that accurate. So having the waist to height ratio is a more of an accurate description of someone that might have secondary obesity associated with lipedema. And that was, that was really obvious in that at the conference with the German guidelines showing those criteria, and that's how they can they pick their people to do liposuction.
Yeah.
Otherwise, they might need to go on weight loss medications concurrently, or beforehand, or as well, to help with weight loss.
Mm.
Yeah,
And
because we want the best surgical outcomes, and we want,
mm,
we want it all
yeah,
to be able to work properly, don't we? So we need to be in the best shape possible when we hop on your table.
I'm curious about that. People come to get liposuction to remove excess fat. And then the perception, I could imagine that if I was living in a larger body, the fact that I'm told to lose weight before coming into surgery I would really struggle with that concept, because I'm like, well, I've come to you to help because I've tried.
Yeah.
So apart from the fact that if you lose excess weight, your surgical outcomes might be better because you're maybe fitter. And this is, I suppose, an assumption that you're potentially fitter and potentially healthier, not always the case. But is there anything else we need to consider to have less of that excess body fat and not be obese in order to get the best surgical outcome?
Yeah, well, that's I've had a few patients where I've asked them to go and see their GP at the same time to start them on the GLP-1 receptor agonist medications like Ozempic and Mounjaro particularly. Look, some of the patients have even tried these things before. Obviously, they do try everything they can before they go to, come and see me for liposuction. We do also know that liposuction is the only surgical method of reducing lipedema fat. There's a and also for symptoms control, but it's the only surgical way. All the other things like wearing compression garments, keto diets, and what do you call it? The red light therapy or dry brush and all those things. They just manage symptoms, but they don't make the lipedema fat go away.
Yeah, that's right.
Yeah.
It's
Yeah.
almost like the fat cell is filled with fluid and inflammation, and all of that other stuff just reduces the fluid in the cell, but we can't get rid of the fat cells any other way than pulling them out.
Yeah. And even if people have lost weight in the past, this fat is incredibly resistant to diet and exercise. Yeah, as you know.
Don't we know it?
But those ones that patients that have like the verging on secondary obesity, I think doing the liposuction and being on the medications at the same time can be really helpful. And particularly when they do the liposuction and then they see this incredible change to their body.
Yeah.
And it's not just, for me, it's not just like indiscriminately just taking out fat. I take it out in a very organized way to change the body shape. So I'm very geared cosmetically as well as wanting to provide the patients to have a treatment for their lipedema. So
yeah,
it's
I'm so
important.
glad you mentioned that just off the cuff, because there is some discourse again in the community about this panic to get the diseased cells, or whatever we want to call them, the lipedema out. Just get it out, get it all out so that it doesn't grow back. But when we're talking about the form of the body, that contouring that would equal a nicer cosmetic outcome is sort of they're at odds with each other to getting out all of the lipedema.
Yeah.
So is there, where do we find that balance? Is it really necessary to get out all of those cells, or is it fine to have a contoured and approach where there is still some there? It's not going to grow.
Because we need fat.
We need fats healthy, right?
And you also need a buffer between the skin and the muscle. So it's really important when anyone does liposuction to protect the skin. You don't want to get too close to the skin because you don't want to kill the skin blood vessels either, where the skin can become necrotic and die. But also you want that smoothness too. So it has to have a bit of a buffer between the skin and the muscle. So the idea is for me to approximate the skin more closely to the muscle by doing liposuction in that subcutaneous area. And that's the majority of the fat anyway. Whether someone's got lipedema or not, that's the idea for me is to get it down to that level. And if you get too close to the skin and it's too close to the muscle, then it can start scarring on the muscle too. So it can start adhering. So then it starts to look terrible. It looks like you've been.
That doesn't sound good at all.
Then it looks like you've been, eaten by a shark or half eaten by a shark.
Yeah, and the healing would take a bit longer too, wouldn't it? If you've got the skin adhering to muscle and
Yeah.
I suppose we have compromised connective tissue anyway. Then the healing is if it's not done correctly and by somebody who knows what they're doing, there could be real implications.
Yes. Yeah, exactly. So, but yeah, I want to take out as much as the fat as I can in one session. I'm really careful too about separating procedures accordingly because, I work in a day hospital, so there's no overnight stay. And I do the tumescent local anesthetic technique, which is also the recommended technique that the German guidelines have have suggested. And this method's been around for like 38 years. It kind of really revolutionized liposuction. It was developed back by Dr. Jeffrey Klein in America in 1987. And before that, liposuction used to be much higher risk procedure. People used to have to stay many nights in hospital, high risk of blood transfusions. But this method, when it got devised, massively reduced those complications, and it's been used worldwide ever since. So what that involves is large volumes of saline with the numbing drug lignocaine in it, and also adrenaline, which is a very powerful constrictor of blood vessels. So that extra volume of the saline puts the subcutaneous fatty tissue under some good tension and pressure, allows, and lifts the skin off the muscle, gives you a much bigger working plane to work in, and allows for, doing a lot of contouring. That method is also lymph sparing. So that's is very important when you're doing liposuction to protect the lymphatics. There's always going to be swelling after liposuction. I have to divide the procedures accordingly, because you have to think of patient's recovery. You have to be able to function afterwards. And also, lignocaine is very safe if it's used in the right concentrations. But if I gave someone it excessively, it could be toxic to the heart and the brain, and it can cause death. So that's another reason why you need to separate procedures accordingly.
Yeah. So you can't just have it all in one go.
No, and if someone does have it all in one go, what I find is that specific area is not being comprehensively treated, I suppose, or liposuction. Each of these procedures take me about 4 hours to do anyway. A common scenario, particularly for a lipedema patient, is doing like inner thighs, knees, and anterior thighs, and that would take me 4 hours to do. And I do that area under the tumescent local anaesthetic technique, and I do it comprehensively. And then if they want their calves and ankles done, that's done at another time. And if they want their hips and their outer thighs done, that's done another time. Because it's also, it's hard on the body too. It sounds great. Oh, let's just do whole body liposuction all at once, because I've got to go back to work in 2 weeks' time. I mean, you wouldn't be able to move if that happened.
Exactly.
No. And so are they under a twilight sedation or general twilight?
Yeah, no, twilight sedation, or moderate sedation. I have another doctor, anaesthetist, that provides the sedation. And it's also really important to be able to get the patient to move into adequate positions. Now, if someone was under general anaesthetic, they could weigh 50 kilograms, but they've weight that feels like 150 kilograms when you're trying to move
like
something.
a dead weight. Yeah.
Weight, yeah. And also, to get the fat out, you've got to go from different directions, and you just can't do it while they're lying on their back. Also, so the patient's able to move under direction. She probably doesn't remember. 4 hours go by, but it feels like to her afterwards, it feels like half an hour's gone by.
Yeah.
So they forget a lot because of the medications, which is good. But they're very chilled and relaxed. Also, near the end of the procedure, I'm able to stand the patient up just temporarily with the help of the other staff, because the effect of gravity on any remaining fat makes that remaining fat a bit more evident. And it allows me to mark it out and to get better symmetry, that sort of thing. And 100% of the time, I go back and find more fat and go back and do more liposuction. So to me, that's a really, really valuable part of the procedure.
Yeah, and before the swelling started as well, so you can see what it's actually going to look like. Yeah,
exactly.
Oh, that's interesting. Yeah. I'm also interested to hear more about and it's okay if it's not distinct, but any distinct challenges of early stage lipedema in terms of your surgical approach compared to someone without lipedema?
Yeah. Look, I find with lipedema, there's so many variations in people's symptoms, from mild to moderate to severe. There's probably people out there that don't know that they've got lipedema, but they just want to get their outer thighs liposuctioned because they want it to look better. Yeah. Or there's just heaviness, that sort of thing. Heaviness is a really common description of their thighs. The difference doing the procedure, no difference to me doing the procedure. I have the same method that I do each time. Lipedema fat sometimes is a bit more globular, I suppose. Depends on the level of lipedema that they have. Patients feel like it's rice underneath their skin, or lumpiness, sore to touch, or they bruise really easily. These are all very common symptoms. Yeah, I'm sure there's people I've done liposuction on and have got lipedema, but there's unfortunately no like blood tests to say, yeah, this is your diagnosis. It's not like you do a pregnancy test, okay, and that's you're pregnant if it's positive. So it's not like that, unfortunately. So there's such variations in people's descriptions of what their symptoms are. Yeah, basically, I do the procedure. I have the same method that I use each time. Like I might need a smaller cannula, like a 2 millimeter cannula, may not work with some lipedema patients because the fat's too globular and it blocks the cannula.
Okay.
But I don't use really large cannulas anyway. Size 3 is 3 millimeters is probably about 3 to 4 millimeters is max that I would use because
I
it's.
suppose you wouldn't know until you get in there, right? Like you wouldn't
That's
know
right.
until you
Yeah. And there's different cannulas with different designs as well. Like some skinny ladies that want to have a bit of shaping, sometimes their fat is really, really hard to get out. Yeah.
I can imagine,
So it's like sometimes a bit more fibrotic, the feeling. But yeah, look, definitely lipedema patients, it is more globular, I find, the fatty tissue.
I feel like that's a bit reassuring for us as people who suffer with lipedema, because there's a lot of times where Shell and I have said that we both think, well, maybe we're just fat.
Yep.
And maybe it's not lipedema. Like often we have this conversation in our head that, well, maybe I've got extra fat, like, and I'm just not working hard enough. But then to hear that the fat is actually different, I need to hear that so often in order to not completely gaslight myself that I'm just fat.
Yeah. And another common thing that patients do, particularly on the calf, is they squeeze it and then you can see the globularness, globule of the fat underneath it, underneath the skin. So that's a very, very common thing that people show me when they've got the lipedema fat.
Yeah.
So normal fat wouldn't do that?
No, because it's thicker globules. Do you know what I mean? It looks thicker. Sometimes people have got fat on their underneath the skin, but it doesn't look like, when you squeeze it, it doesn't look like peas or rice, walnuts, that sort of thing. Yeah. If that makes sense.
Good to know. Really validating for us. Thanks so much. So I'm curious, because you did mention before that you work mostly with stage 1 lipedema ladies, but what determinants do you use to qualify someone's lipedema stage in order to know if you're the right proceduralist for them?
Yep. There's the lipoedema.org, I think it is. They've got a staging of lipedema, which has got pictures of like stage 1 and 2. And I sometimes show that to the patient. And it's actually that link's on my website too. So if the patient's not aware of what stage they are, they can have a look at that to determine. I mean, it's only one patient, but it's a quite a good description, or a visual description of it. And it's also to the point where they've got not excessive skin, because, the skin will retract after liposuction. So once I de-weight the skin of its underlying fat, it will naturally shrink to a point and re-drape over that new liposuctioned area. But, if it's really excessive, then people will need to have, surgical excision of the skin.
Yeah.
Particularly, that stage 4, some of the pictures, it's like, looks like people have got cauliflower growing out of their legs. I know. Yeah. And I'm not even sure how well that could be managed surgically for, for the really end stage.
That brings to my mind that if you have the means, then if you can get it out, then and I suppose progression is not promised either. So it's hard to say. You invest not knowing whether you would progress.
Yeah. Well, that came up at the lipedema conference, and the progression rate was 28%. So, which is
That's not very much.
Yeah, it's not. It's almost a third, I suppose, or less than a third. But that's right. It may not progress. And what a common thing that I get told by patients is that, well, my grandmother probably had it, and she had really bad arms, and the skin was down to here. And if she'd gotten treated early or had liposuction early, if it was around and one knew about it, then she'd probably be able to reduce some of that progression.
For sure.
The skin hasn't been excessively stretched if you can get in the early stages. But as you know, this procedure is extremely it's expensive, because if you're young, unless your mum and dad come and pay for it,
That's right.
it becomes unaffordable. It's an item, and there's no Medicare or private health insurance rebates with it.
Yeah. It is. It's definitely a privilege to have the means to be able to have some
Mm,
kind of intervention like this.
mm, mm.
And
Yeah.
how do you determine if a patient is surgery?
Yep. Okay. So from an anaesthetic point of view, yes. So I do a proper assessment of that beforehand. So once again, I'll probably only see this thing called ASA 1 and 2, and that's the American Society of Anesthesiologists. It's used worldwide as a kind of a guide for risk factors for anaesthesia and surgery. So yeah, so one and two is pretty much like what's say one is like a fit healthy person, doesn't smoke, doesn't drink much, doesn't take any medications. ASA2 might be someone that's got like maybe a little bit of high blood pressure, but it's well managed on medications, or they've got diabetes and they're well managed, or asthma and they're well managed. Look, smoking's not good with any surgery, so that's a big no-no, and it's not good for healing either.
Mm.
And it's really, from a cosmetic point of view, smoking is really anti-aging. So it's going to make someone older really quickly.
Yeah.
Yeah,
So
wow.
Yeah.
Yeah. I mean, you can tell.
Yeah.
yeah. And I just think that, patients who are really motivated with this sort of thing aren't smokers anyway, which is good. So most people that come for liposuction don't smoke. And yeah, so that's, if someone's had like a stroke or a heart attack, or they're still having chest pain, that sort of thing, that's not a person that I would operate on. Yeah.
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 We want to keep those risk factors down so that everyone has a good outcome.
Yeah.
And you're right, with the people who come to you, they're already looking after themselves, and they want to, are very health focused and want to make sure that they're looking after themselves properly and doing all these things. So you wouldn't think you'd have someone turning up who's,
Yeah.
smoking, drinking,
Yeah.
all the
Yeah.
things.
And all my patients go home. They don't stay overnight in hospital. They all go home. So
Yes,
and
they have
this
to have
is
a good support system.
yeah. This is a totally elective procedure. You need to make sure that the people are properly assessed and chosen beforehand,
Yeah.
because otherwise we have to send them off in an ambulance to a hospital. So it's just not good practice. Yeah, and it's not. I know it's for people with lipedema. I know that they know it's a necessary procedure. Medically, liposuction is not considered life-saving surgery. I know people would beg to differ, because it does change their life, but it is not considered medically life-saving.
Not yet.
Yeah. Hopefully, I'm hoping after what Germany did this year, hopefully they send waves around the world where other countries follow.
Yeah.
Yeah. We're hoping for that too.
Yeah, we are.
Yeah. So what will your patients expect from their care journey with you? Like, if they want to enlist you as their doctor, like what happens next?
Okay, so they make an appointment. And the guidelines, there's quite strict guidelines around cosmetic surgery, even though it's liposuction for lipedema, it's still the same thing. So we have to do 2 consultations. One has to be face-to-face in person, and the other one can be done via a video consultation. After the second consultation, there would have to be a 7-day cooling off period before they could book surgery.
Oh,
They also need a GP referral, and that's mandatory as well. Yeah. So, and that's the
Okay.
process.
fascinating. Yeah, the 7-day cooling off period. I've never heard that before.
Yeah.
And the GP referral, I'm curious, what would the GP have to, like, is it just a tick and flick thing for them, or is there something that they need to investigate?
Yeah, this happened, came in July 2023 when it comes to any cosmetic surgical procedure. So the medical board made that a mandatory thing, that the GP had to provide the referral before anyone could have any level of cosmetic surgery. So it's just, it is quite a strict, there's quite strict guidelines with it. So we won't see anyone doesn't have a GP referral. And it has to be a GP that's a GP, not somebody that works in a cosmetic clinic or gives Botox or fillers and that sort of thing. They can't working in that cosmetic space. And after I'm just trying to think what else with the regulations. Yeah, so once they've had the second consultation, then they sign a consent form, but they've got 7 days to cool off still, and then we can book their procedure for them.
Okay. And where do you operate from?
Sorry, I just wanted to say one thing. I do a body dysmorphia disorder questionnaire beforehand. So that's another
Oh,
regulation that needs to be done too. That's what I was trying to think of.
yeah, that's so important. And even like we speak to a lot of women in the community, and there's a lot of body dysmorphia, and
Yeah.
especially after surgery,
Mm.
like because their brain doesn't have time to catch up to
The new body.
the new body, and they
Mm.
still buy clothes in bigger sizes, and they're doing all those things because they don't see themselves as having smaller legs now.
Right. Yeah, okay.
Mm.
Yeah, I think that it's really, really important whether you've got lipedema or not. And I definitely understand the emotional journey and anguish that this condition creates. But it's no amount of cosmetic surgery is going to fix someone that's got a psychiatric condition.
Yeah.
Yeah. So, it's different. Real body dysmorphia is different to people with lipedema and just think, well, I hate my legs. I've always hated my legs. That
Mm.
sort of thing. It's not like it stops them living their life. I mean, they live their life still and they still have relationships with people. They still go to work. If people can't go to work and can't have relationships because they're so fixated on their appearance, then that's a psychiatric condition.
Yeah.
And they need, when we do the screening, if someone scores quite high on that BDD questionnaire, then they really need to go and see a psychologist before they consider any liposuction or any cosmetic surgery.
Yeah.
Oh,
Work
that's
on the
sensible.
mental health side of it first.
Yeah.
Yeah.
It'd just exacerbate, really. Like surgery would absolutely exacerbate something like that. Considering I've been through 2 surgeries myself, and the mental gymnastics that you have to do, the psychological gymnastics that you have to do to recover from your surgeries. If you had something like body dysmorphia as well, that would be really, really tough. That would just
Yeah.
exacerbate it.
Well, it'd be extremely. It's not a good thing for any doctor to operate on anyone with BDD.
Sure.
Yeah.
Yeah, I
Yeah,
mean,
they'll never get the perceived outcome that they want.
yeah. You don't look with the screening questionnaire, that puts people into sort of a risk factor, but it doesn't diagnose it. And sometimes people can slip through as well. So it's only a
Sure.
questionnaire. Yeah.
Because they know what to say.
Yeah.
People know what to say. When you go to the doctor, or you know what you're going to say. Most
Yeah.
of us will rehearse what we're going to say. We know,
It's true.
Yeah. Yeah.
just
Yeah.
what it's like now.
Yeah, it's
Mm.
true.
We're
Mm.
over
Prepared.
informed.
Yeah, and self-aware.
And
We're very, very well educated.
Yeah.
yeah, Google's been great.
Yeah,
But-
ChatGPT.
How do I slip through the loop?
Yeah. oh
yeah.
gosh.
She's going to come at me with this.
Yeah.
What am
Yeah.
I going to say?
Yeah. How do I?
Yeah. Yeah.
That's tough.
Yeah. Yeah.
Mm.
So what are your recommendations when it comes to a successful surgical recovery?
After I've done the procedure, we put the compression garments on the patient. So I usually use 2 garments, and we put these absorbent pads in between because you leak a lot of the excess anesthetic fluid. Some of it gets sucked out during the procedure, some leaks out on the bed, and the rest of it will leak out a lot overnight when the patient goes home. So the patient goes home, stays as they are. Is usually they can go to the toilet because there's a little a crotchless suit without taking the suits off. So the next day they're able to have a shower, but then really they just need to wear the compression garments for a minimum of like 2 weeks after the surgery, day and night. And they can wear them longer if they want, or sometimes they've got better compression suits than I've got because lipedema. You spend a lot of money on these fabulous, garments. Yeah. So and they can substitute them for those as well afterwards. Some lipedema patients, wear lipedema compression garments all the time. A lot of them don't. Yeah. So some of them don't find it that much very helpful, and others do. So even after liposuction, people may still choose to wear long-term compression garments, but hopefully they don't need to.
Yeah. They can have more
The
off
idea.
days than on.
Yeah.
Yeah,
I
or just
certainly have times where I feel like I need my compression garments, and then times where I feel I'm okay without them for short, like for a day or 2. And then there's times where I just ignore the fact that I should probably wear my compression garments. So
Yeah. Okay. Well,
even though I'm
if
post-surgery, the garments are
yeah.
helpful still
Yeah.
to some capacity.
And if it gets to that point where you've forgotten to put it on, that's a good thing, hey, because then it's
Yeah,
not obvious
totally.
causing you much issue.
That's
Yeah,
right.
so look, numbness is a very longer term thing that takes a bit of time to go away. So some people like to wear their compression garments because they just feel a little bit more secure with them on. Yeah, but the maximal swelling's between the first and second week, and that's where the compression garments are most helpful for that part. And then the tissue starts to go a bit hard and firm, and the compression probably doesn't do that much more for the swelling. Yeah, the minimum 2 weeks is really what I say for patients. However, the calves and ankles and the lower areas, I would say minimum time 4 weeks in compression garments. Yeah. Just because it's the most dependent part of the body, swelling is a bit more persistent around the ankle for longer because everything is controlled by the heart. So the lymphatics take all the excess fluid and everything back to the heart. So, it has to fight, uphill against gravity.
Yeah.
So that's why the lower areas need compression for longer.
Can I
that
ask
makes sense.
specifically about the arms or the abdomen? So if you did liposuction of the arms or like liposuction of the abdomen, is that 2-week period of compression still the period or whether you extend it?
Yeah, with the tummy, with the abdomen, yes, 2 weeks. With the arms, because it's above or at the level of the heart, I'd say a minimum of a week for the arms. Yeah,
Oh,
because
wow.
it's got
Less.
gravity
Wow.
on its side, so the swelling tends to go away more quickly than the lower part of the body. So
Okay.
that's
Nice.
correct, yeah. And then
So,
other journey, sorry, after that, and then I usually see the patient within hopefully the next day. But if that's not possible, then usually within a week of the procedure, and then I usually see them around about the 6-week mark, and I usually see them around about the 3-month mark. But of course, they can have more appointments if necessary.
gotcha. What about post liposuction care? Apart from the compression, like manual lymphatic drainage, do you sort of recommend? Do you have a protocol that you would like your patients to follow?
I don't make that mandatory at all. I say, look, wear the garments is the most important thing. But a lot of lipedema patients and even non-lipedema patients like to get it done. So I do have a little list of lipedema therapists that are very good that I can give the patient. And sometimes they tell me they went to see someone that was fabulous. So I put that on my little list as well.
Nice.
So lipedema patients are the most educated group of patients I've ever come across. And like I haven't done general practice for about 25 years, but I've never met a group of patients that are so well educated, honestly. I mean, you teach
We have
us.
to advocate for ourselves.
Yeah.
Yeah.
Yeah. So all the ins and outs and all the therapies and everything.
Yeah.
But look,
I'm with you.
yeah, lymphatic drainage massage, a lot of patients find that really, really helpful.
Yeah.
But other patients haven't. Yeah. Look, I've had liposuction myself, and I did not want to be touched when I had liposuction because it hurt.
Yeah.
And I
That's
think,
so interesting.
yeah, but I think these days there's such a science in the therapy. Now it's not just a little massage type of thing, and it's not a deep remedial remedial massage with deep muscles. But it's a lot of good education for the therapists out there. And it's
Yeah,
quite technical.
definitely. Yeah,
Yeah.
definitely quite a technical approach. Yeah.
Yeah, for sure.
Yeah. Cool. So we're down to the last couple of questions. Really important one. Where can the lipedema community find you?
Okay. So I've got my liposuction practice is called Be Sculptured. So that's my website. They can even just Google my name and it'll come up. I'm at Gold Coast and I'm in Sydney. So I commute between the two places. So I'm probably in Sydney more, but I love being on the Gold Coast. I've got, family up there. So I've been going up to the Gold Coast for, quite a few decades. And now I'm working up there, which is fabulous. I love it.
Well, it's good for us that live in Brisbane and the Gold Coast.
Yeah. So I work out at Southport Day Hospital on the Gold Coast. And the main hospital I work out at Sydney is called Kingsgrove Day Hospital. That's near the airport. It's quite close to the airport. But my practice is at Bondi Junction in Sydney, where I consult patients. But I also see them out at Kingsgrove at the hospital too. So we've got consultation room out there so the patients can come there as well.
Awesome. I'll put all that in the show notes where they can find you.
Mhm.
Yeah. Do you have consultations at the Gold Coast, not just your procedures?
Yes,
Yep.
yes. So at the Southport Day Hospital, there's a few consultation rooms. So yeah, I see the patients there too for
Okay.
post-ops and pre-ops and first consultations, etc.
Excellent. Excellent.
Mm.
So last question, and it's okay if there's nothing, but if there's anything exciting we as a lipedema community should know about that would impact. Yeah.
Like something new and exciting.
Yeah. Anything with you or anything with the procedure itself, any new information, any new research, opens ladder.
Yeah, even like going to the conference, like what did that bring up for you?
Yeah, I was just about to say that. I actually rejigged my lipedema form. It used to just be on 2 pages and now it's 4. So, so since I went to the Lipedema conference in Canberra, and that's on my website, so it's a PDF file, and it's a real. I worked a lot on it. It's a real good summary of the symptoms and the history of lipedema, but also there's some really good attached. Like it's about a page and a half of references from
Excellent.
particularly liposuction for lipedema and just the studies that have been done around the world and the success of it. So I think that's, an educational thing. I know it's a medical journal, but as I said, you guys are so educated that I think you probably understand medical journals.
We're like a dog with a bone. We just have to know these things.
Yeah, you can decipher that you can say whether that's a good study or a bad study, No, but I put together that, and that took quite a bit of time, but I feel quite happy about that info leaflet for patients. And even though if people don't want to have a look at the real study, then I've just put little summaries underneath the study to sort of show what the study showed.
Awesome.
Oh, thanks for doing
We'll have
that.
to check it out.
That's
Yeah.
awesome.
Yeah, that's great. I mean, look, because you come from a different avenue than we're used to in the community, you would be seeing people without lipedema or people that don't know they have lipedema but actually do. And so having that awareness on your page, I think, is going to make a heck of a difference.
Yeah.
Just for the clientele that you would see outside of the lipedema community.
Yeah.
Yeah. Yeah.
And
Yeah.
being a specialist general practitioner, are you able to diagnose?
Well, look, I never learned about lipedema at medical school. I mean, this is going back many years, so it was never a part of anyone's curriculum. And when I've seen the other podcasts with the other doctors before, and they all say the same thing. It was never taught. I know it was first talked about in 1940 in the Mayo Clinic, but there was this description. It didn't sort of come up with any kind of this is the problem, this is the treatment. It was just more of a description. It was first described then. It wasn't kind of first diagnosed, and then you have all these wonderful treatments afterwards. So yeah, it's really educating everyone about it, like doctors as well. When I did general practice, my fellowship, which was over 25 years ago, I mean, that wasn't even there either. And even GPs now that have to provide the referral, sometimes they say to the patient comes in, I think, I think I've got lipedema. And they say, no, don't you think you've got lymphedema instead? Because we all know what lymphedema is. Because there was no such, word or medical diagnosis as lipedema back when we all studied. And that still happens all the time now.
Yeah.
So
until we get a diagnostic tool that everyone can use.
That everyone agrees on.
But yes, I do diagnose it and I say, you've got X, Y, and Z. You've got all these symptoms and you've got all these signs that are very, are specific to lipedema. So it's just putting it all together. Yeah. But as I said earlier in the podcast, not everyone suffers the same either.
Yes.
Yeah.
Yeah. A lot of
Present
people
so differently.
Yeah.
One people could have pain, stage 3 people could not experience pain. Like it's so different.
Yeah. But also like people, as I said before, I'm cosmetically geared, and I find that's really disheartening for patients because they don't look the same as the other girls. They don't look the same as the other girls at high school, and they don't look the same as everyone else. And they say, well, why has that girl got legs like that and my legs are like this? So it's really a very emotional journey, that, and trying to change that for people. So they feel they want to, I know I don't like saying this word, but they want to feel like more normal.
Yeah.
Yeah.
Yep.
It's true. And I don't like saying that either, like what is normal.
Yeah.
Exactly.
But it feels that way.
Yeah.
Yeah. You
Mm.
want to be in proportion, I suppose. We want to be proportionate.
Yeah.
Yeah.
And that's another thing, a lot of lipedema patients feel like they've got a body in two halves. The top half doesn't match the bottom half. And they go, what's going on?
Yeah.
And, and if they have lost weight in the past and they've dropped a lot of kilograms, they're skinny and scrawny around the chest and tummy, and then the legs don't change.
Yeah.
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 It's fascinating and
Mm.
annoying.
It's annoying.
It's annoying. Well,
Yeah, that's
Dr.
where you go.
Heckenberg, thank you so very much for spending the time
My
with us.
pleasure.
I really think that conversation about proceduralists and cosmetic surgeons and plastic surgeons really needed to happen.
Yeah.
Our community is just desperate for assistance. And as long as we go to somebody who is experienced in liposuction and who
Yeah.
helps to support our lymphatic system through whatever methods they use, it sounds like, and also, you can build a rapport with, it sounds like you go with your gut on that.
Yep. I think that's good advice. I'm glad we sort of dispelled that, because it is important, and because it's a different learning of medicine, I suppose, but it doesn't get taught in medical school, doesn't get taught in any fellowship program. It's something that we all have to learn, once we've become fully fledged doctors.
Yeah.
And then you've got to learn those skills and utilize those skills to benefit the patients.
Yeah. Nice.
It-
Thank you very much for your time. We appreciate
pleasure.
it.
Hey, thanks,
Thank you.
ladies. All right. Bye, Sean.
Bye.
Bye.
The Lipedema Podcast 2025 is powered by Elegance Lymphatic Care. Lipedema and its symptoms vary from individual to individual. The opinions and advice voiced in this podcast are of a personal nature and used for educational purposes.
Please take away from this podcast what resonates with you, and please see your GP or preferred specialist for diagnosis and healthcare. We are Shelley and Tiana from the Lipoedema Podcast. Until our next episode, bye for now.